Dangerous, Debilitating Impact of Migraine Disease webinar. My name is Holly Foxworth. In case we haven't met, I'm a registered nurse. I'm the marketing manager for content here at Axiom, and I'm joined by a fantastic panel today. On our team, we have Senior VP of Behavioral Health, Dr. Les Kertay. We also have Chief Marketing Officer Dara Wheeler, and we also have a new face. We have Kelly that's joined us from the Migraine at Work team, so you will meet them shortly. A big thanks to all of you who submitted pictures. We had such a fun time several weeks ago with the Venomous Foes webinar that was done, and we appreciate all of the pictures. They were absolutely adorable. The snake tattoos, all of the things that you sent in, they were absolutely a riot, and we appreciate those so much. So we have a lot that is planned for this next quarter. We have who's to blame for strains and strains, and I think you may be surprised when we give you the answer for that one. It's going to be the next one, and then as we get into September, you have all the kids that are going back to school, and we have all of the commitments that come along with that. You've got the holidays, you've got budget plans, you've got, okay, what are your magic plans for how you're going to make everything so miraculous in 2024? So in September, we are bringing through and discussing imposter syndrome. So in case you haven't discussed that before, we tried that topic out yesterday on our own team. We had such a great time with Dr. Les Kertay. He led that. So definitely a lot of good things in the works for the quarter, and so you don't want to miss those. So in terms of today, what I want you to focus on is obviously at the right-hand side of your screen at the top. That's where you will reserve your seat for the next month when we're talking about sprains and strains. Click that button, that'll get you registered. But then below that is where you'll see that there's lots of resources today. So we're going to be talking about a lot of questions to ask and how to talk with your doctor. We're going to be talking about how it is that you can discuss this subject with your employer or with your employees. So there's lots of great resources, checklists, et cetera, that are there in that resource section that you may want to check out. Obviously, we love to talk, and that's why we're here. That's why you're there, hopefully, as well. So let me know. I want to hear throughout the event, why are you here? What brought you here? Do you struggle with migraines yourself? Do you know somebody that struggled with them? Is this something that's being discussed in your workplace? Whether you have a comment, question, whatever it may be, I want to hear all of them. And we have great gifts to share. So please put those in the comments section. We want to hear from you throughout the event. So let's go ahead and introduce our guest. How about we start with Dr. Les Kertay, and then we'll go to Dara, and then we will wrap up with Kelly. Dr. Kertay?
Thanks, Holly. So I am Les Kertay. I'm a clinical psychologist by training and, as you said, Senior VP for Behavioral Health here at Axiom. I've been, have a long-standing clinical practice working mostly actually with kind of on the boundary between mental health and physical health. So have that expertise. And then I've spent the last 20 years really focused on workplace mental health. And so this will be an interesting conversation to have.
Absolutely. Well, thank you for joining us. Dara?
Thank you, Holly. Hi, everybody. My name is Dara Wheeler. I'm Axiom Chief Marketing Officer, and I've been with Axiom for a beautiful 17 years as of this week. And I cannot say I haven't had any work-related migraines. I think there may have been one or two over the years, but this is an interesting topic, and I'm glad we're talking about it. I think it's going to be a kind of a new area for us to discuss, but I'm really interested to dig in, and I'm glad Kelly was able to join us. So, Kelly?
Awesome. Kelly?
Great. So I am Kellier Pokrifka, and I think the best way to give my introduction is to try to help deconstruct the stigma of migraine a little bit, because a lot of people, they hear migraine, they think, oh, it's a bad headache, you take a pill, you get over it. I am definitely not that case. So I had never had a migraine attack before I was 19, and I suffered a concussion. And since then, it has been over a decade, and there has not been a single minute that I have not been in a migraine attack. So that's excruciating pain, it's vomiting almost every day, it's constant fatigue, it's poor sleep, poor immune health, just everything has trickled down from this migraine. And because of that, this led me into this field. So Migraine at Work is a nonprofit coalition, and everyone involved in it has had their career pretty derailed from migraine. And so luckily, working for them, they fully understand. And I think the most important part about that is that every workplace can be doing this. Everyone can have incredible workers who would otherwise be taken out of the workforce. However, if they're given simple accommodations and gentle understanding, it's not even doing it because, you know, you're a good person, you're a nice company, yada, yada. It's because it's great for the bottom line, it's efficient, and these people deserve work and they deserve the empathy from everyone around them. So I am very excited, and I've also had the privilege of interviewing the top neurologists and headache specialists across the world. So I can't offer medical advice, but I would love to help direct anyone into resources they need, any extra help. So if it's through the chat today, or if you want to email me after at kelly@migraine@work, I would love to direct you to any sort of resuresources. Thank you all for having me today.
Yeah, we're so glad that you're here. It's great to get somebody that has such an expertise in this area, because as we talked about, you know, it's not something everybody knows. So to give you an idea of what we're going to go through, so we're basically going to talk through some of the impacts, obviously, of migraines. We'll go through recognizing what those red flags would be, what it is on how you can dodge some of those triggers, how it is that you need to address your migraine whenever it starts, so some of those countermeasures, and then we're going to talk through the workplace accommodations. I think that one's a huge one that should be a huge benefit to you guys today. So Les, I'll come to you first, but just kind of setting us up and what we want to talk through here. Whenever I saw this or heard this from Christian Chenoweth, it really got my attention, because I think it took me back to the days of mental health when we were talking about that nobody understands because you can't see it. And so it really, you know, it just kind of brought me back to that time period where it's like, man, we have a problem, but you can't start fixing the problem until you know how to fix that and how to recognize that. So talk us through who's affected, what we need to be looking at. Is this a male problem? Is it a female problem, et cetera?
Sure. So, well, it's here on the slide. You know, it is more common in women than in men. It is not uncommon. And there's a fair number of people, and I think this is important, you know, that 40% of people with migraines have not been diagnosed. You know, and it's important to recognize that there's a huge range here. There are, you know, there's status migrainous, which is what Kelly has described, which is kind of constant migraine. And then there are people people like me who have 2 a year, right? During that 2 a year, it's really, really bad, but I can go in a dark room, turn the air conditioning up so it's cooler, and I'm okay, right? So there's a huge range here. And I think that's really important. Going back to the previous slide, I think something that I really notice, you know, Kelly, you've described, you know, constant migraine for 10 years. And yet you come across as being quite functional and cheerful and, you know, right? And that really gets at this whole problem of it's invisible. Like, how would I know if you didn't say that, right?
Exactly.
So I'm sorry, I didn't mean to make you go back a slide, but it just really struck me that this is not an uncommon problem. It's widespread, but we don't know. You know, I promise you that when I'm in the midst of one of my twice a year migraines, you know, because I disappear, right? But that's not obvious, and it's not obvious when it's coming on, and it's not obvious unless somebody tells us if somebody has a frequent migraine, for example, like I'm out 1 day a week, I'm just not functional, right? So I think those are really, really important things, and they're, you know, it's not an accident that people with migraines are more likely to experience sleep disorders, mental health disorders, chronic pain. I mean, it is a form of chronic pain, as a matter of fact. All of those things go together, and they're all largely invisible. Right? The only one up here is obesity, and you know, that's maybe visible, but even then, you know, it's like, is it apparent that it's getting in people's way? So I think that's an important factor to keep in mind.
Do you think that we know enough about how to explain that about ourselves? Like if we were having a migraine, do you think that there's enough that we know how to explain that to others effectively?
Probably not.
Yeah.
You know, and part of it is, just like there is stigma around mental health, I think there is stigma around headaches, right? Or any kind of invisible functional impairment that's getting in our way. Like, we don't want to admit to it,
right?
You know, and you know, some of us, and Kelly, I'm going to put words in your mouth, and I'll give you a chance to say this differently, but some of us, because we've had to, have learned to function despite ongoing things. Some of us are not as good at functioning, but we don't want to admit it, so we'll tough it out. Which, as a matter of fact, probably makes migraine worse when it's happening. So,
and if I could jump in here, a lot of that is, so many people don't even know that it's migraine. For example, a lot of people have frequent sinus headache or sinusitis, and there's actually a study showing that 90% of people who had recurrent sinus issues actually had migraine. And so if you don't know that you have migraine, you can't get proper treatment. And, you know, migraine, I saw in the chat, someone asked if it was hereditary, and that is largely the case in almost, not all, but a majority of cases, yes. And the first preventative drug was not actually designed for migraine until 2018. So if your mom or your grandpa, et cetera, if they had migraine, even if they did go to the doctor for it and knew that it was there, they would say, oh, don't bother wasting your time going to a doctor when there's no good treatment options. And that's not the case anymore. So we've learned so many things in the last 10 years, really, that have really changed the game in terms of migraine treatment and migraine diagnosis.
We've had some comments that have came in, some really good ones. Unfortunately, it looks like a few of them have migraines as well. They're with you, Kelly. They're struggling with it at the moment. Yeah, so thoughts with you there. There was another one, though, that was asking about, let's see, I thought I saw one that was talking about they have one several times a month. And they were talking about bringing that up with your supervisor. So we definitely are going to get into those discussions and then what it is that you need to say and things of that sort. Dara, talk to us about the workplace impact. So you as a supervisor, I'm sure you've got to sit in both seats there, being the employee and the supervisor with employees that are struggling. So what does that look like from a workplace perspective?
Yeah, it's really interesting because I think, like I said, I even though I've had employees that have had migraines and I've had them myself, it wasn't something I really considered as a more broad impact across an organization. But I think the group of people we've talked to from Migraine.org and from other groups, they pointed me in that direction, in that there is a huge cost to employers, and it's very similar, if not more impactful in some ways than other diagnoses. And I think, like Holly and Les and everybody have said, we've spent a lot of time talking over the last year about the impact of mental health at work and its cost to employers to ignore it. And there's a lot of parallels between migraines and mental health stigma and cost to employers. And I think Les said it well too. I mean, I know, Kelly, you're functioning. When I get a migraine, I don't. I do not function. And I am in a dark room and I am, vomiting, and not to get graphic, but it is not pleasant. And there is no chance I am working. So, I think the stat here says 90% of people can't work properly during a migraine attack. So it's not just, can you work? Can you even work properly? Can you function? And the cost of that is significant. And so, and Dr. Kertay has talked a lot about this over the last few years about that. If you've joined our webinars about mental health, about presenteeism, so people may not feel all that comfortable calling out from work for things like migraines, but if they do show up, what's happening then? And we have a lot of you in our audience are in the world of safety, and I really struggle with this concept of, if somebody's not doing well and not reporting that they're not doing well, what does that mean for the safety of that individual or their teammates? And they're showing up, they're trying, and they really want to be there, but they're not necessarily physically or even mentally able to do the job at hand. And so there's a huge risk component here too, in addition to the presenteeism and absenteeism.
Kelly, I saw that we had another comment that came in that said people just think you have a headache and that you should get over it. I get complex migraines that are like having a stroke. And it said I've been having migraines since I was a child, and I'm now in my 60s. Wow.
Absolutely. It's horrendous. And people just simply don't get it. There's a quote by Kareem Abdul-Jabbar, and he was trying to explain, like, it is impossible to explain, even if your only symptom is just head pain, which of course is rare for that to be the only symptom. But even if it's just that pain can get so disabling that when people dismiss it as a headache, you crumble. It's impossible to do. Yeah.
Wow. Well, talk us through what that looks like then as we look at some of the red flags and kind of what that process looks like, Kelly.
Yeah, absolutely. So we're going to go over some of the phases of migraine attack. So this is the prodrome phase, and this is when things are just starting to gear up. One of the most common symptoms in this phase is neck pain. And so a lot of people consider neck pain a trigger of a migraine, but it's actually, in most cases, some of the first signs that an attack is already underway. So we may be more irritable, yawning, frequent urination, sensitivity to light, sound, taste, touch, sight. All of our senses, like the way our brains are interpreting that information, is so increased that it can be very disabling. The brain fog, just trouble concentrating, memory, that's obviously a very, very big safety issue because it's very just hard to, be in the moment and not just be sort of distracted. Then there's the nausea, difficulty sleeping, etc. And then we get to the aura phase. And so this is one of the trademark signs of a migraine attack, is the visual aura. But actually that's only a minority of patients do have that. And there's other auras besides the visual ones. So the visual ones may be like seeing stars, completely losing vision in one eye, which is very clear safety risk. And like our friend in the chat said, hemiplegic migraine is a type of migraine that mimics stroke. So you will actually be temporarily paralyzed in one half of your body. There's the migraine babble, which is aphasia. So you might say a word and you think you said it right, and it's just a completely different word. Or it'll sound like you have marbles in your mouth or something like that. So there's a lot of numbness, a lot of tingling, just all across your body, because migraine really does affect every system and every part of our body. And then we get into the headache or attack phase, which is what we typically think of. It's just a very, very severe, moderate to severe throbbing, ice pick. There's so many varieties of the headache. And again, a lot of people for migraine, they think one side of the head. And again, that's actually a minority of attacks. Most attacks actually have it on both sides. It's about 50-50, but or 40-60. So it can either be one side or it could be both. So don't let that stop you from being diagnosed. You get a lot of sinus symptoms for some people. So that's congestion, runny eyes, tearing, a lot of anxiety, a lot of depression, just in temporary. Of course, there's our sensitivities, more of our neck pain. We get vomiting, diarrhea, constipation. And then we go into the postdrome phase. So this is frequently called the migraine hangover phase. And a lot of the symptoms are just like a classic hangover. So just completely debilitating fatigue, nausea, vomiting, inability to concentrate, depressed mood. Some people even get a euphoric mood, which is very puzzling to me. Like that, I have definitely never felt.
Yeah.
But yeah, some people get that. So just in every phase of this attack, which can last over a couple days, it's a huge safety risk. So when you are trying to push through and work on the job, there's so many of these symptoms that you shouldn't be working. But a lot of us don't have that opportunity. We're not comfortable enough bringing it up to our supervisors. We need the money. We don't have the freedom to take off that time.
Yeah, definitely. So so is that the time frame there for when the headaches occur in the different stages? Is that fluid? Does it feel like that there's a lot of yeah?
Yeah, so it's completely dependent on the person. Not every person will get each phase. Some people will get all of them. The timeframes are listed here. So like prodrome, few hours to days. Obviously, that's a very huge range. 50 to 60 minutes for aura, 4 to 72 hours for headache, and 24 to 48 hours for postdrome. So if you add those all up, someone can only have a couple of attacks a year, but the amount of days that they're having to take off to get better is they really add up there. Yeah, definitely.
Yeah. Then let's see. Colton was asking, can you have two separate timelines exist simultaneously?
Yes. Yeah.
You can.
They're definitely not like you. Yeah. You won't know when you're shifting.
One from one to the other. Yeah. All right. Go ahead. I'm sorry.
No. I'm just going to say, one of the problems here, I think, again, sort of making an analogy to mental health, like everybody has bad days. Everybody has days when you wake up in the morning and you're blue. Everybody has days when you're feeling kind of a little bit anxious. Well, I think that in some ways feeds some of the stigma, because if you don't understand the difference between I'm having a bad day and I have a major depressive episode that is really debilitating, that's a problem. I think the same thing happens with headaches. Like almost everybody has had a headache at one time or another. People have had sinus headaches. And so we think, since we haven't had a migraine, we think, well, headaches are just headaches and get over yourself.
Yeah.
Right? And it's really hard to tell, these are not the same thing. And so that really struck me as you were talking that, a lot of these symptoms are common.
Right.
And may not be a migraine. When they are a migraine, they're in a class by themselves. And
perfectly
I think that's important.
So, yeah.
Or it might be similar, Les, like you're saying, also similarly, your point earlier about diagnosis, you may have migraines that are undiagnosed, just like you might have major depressive disorder that's undiagnosed.
Yeah.
So you might not even know what to call the thing that you're experiencing.
Yeah.
And we know
Great
there's
point.
so much power in labeling something. I know that, we often feel that diagnoses maybe get kind of thrown around a little bit, or it's like you've got this pop culture kind of reference to diagnoses, but that diagnosis is so powerful because it names what you've got and it helps you start a path to figuring out a strategy or some tactic for managing it. And I think that's the same for both mental health and for migraines. By calling it what it is, you're able to then do something.
Right.
Exactly.
Yeah.
Definitely.
There was another question I was asking about ages. Was there an average age for when migraines usually start to occur? I don't know whether any of you have an answer that you want to expand upon for that one.
Yeah, I do. So a lot of us, or not a lot, in children, it will actually appear differently. So they'll have like a lot more abdominal migraines. So they'll have like cramping or motion sickness. stuff like that. At the beginning of puberty is when a lot of females start realizing their first signs. Again, really at any point in their life when female hormones shift dramatically. So a lot of people will also start at the very beginning of pregnancy. And then menopause can give great relief to some people, but it can also make it way worse.
Wow.
And then 35 to 55 is the most affected age range.
Really? Okay. Okay. Well, talk us through the triggers then on, I assume that you have two sets. You've got the things that you can do something about, and then you have the things that really kind of fall outside of your control.
Yes. So I think one of the most empowering parts of identifying triggers is you can do things about it. So there's something called the migraine threshold theory. So you have this invisible line where anything over top of it will set you into an attack. And so we have our migraine triggers, which bring us closer to that line and further over. And then we have our migraine protectors, which are sort of the opposite of triggers, and they bring us farther away. So we have our diet, hydration, stress, and sleep, and they can both, be either or. So if we have like a great sleep the night before, our diet has been doing really well, we've been exercising, we might actually be a little bit further than that. So when we hear something like a huge loud sound, we're under fluorescent lights, we become a little stressed at work, we're getting closer, but luckily we may be able to still be beneath that line. So we can set ourselves up for success. But again, regardless of what we do, what triggers we engage with, what protectors we help, migraine is never our fault. It's a disorder. If stress or poor diet caused migraine attacks in every person, then every person would get it. You only get these because you have migraine disorder. So don't fall into the pitfalls of blaming yourself. That being said, environmental factors are very relevant for the workplace, of course. So I don't think anyone, in the history of the world has ever enjoyed being under fluorescent lights. For those of us with migraine, like that can be disabling. That can set on an attack so quickly. And also when we're in an attack, it can exacerbate it so much more. So if we can, get to a dark place, even if that means having to go sit in our car until the attack has passed a little bit more, or wearing sunglasses, ball caps, anything to try to block that out, that can definitely help. Strong odors is a huge trigger for a lot of people. So during an attack, and sometimes even for people in between attacks, or the interictal phase is what it's called, we are very sensitive to odor. So that's called osmophobia. And it means that our brain's reaction to different scents, even if they're really pleasant scents, can become very nauseating and set on an attack. So even something as delicious as the smell of chocolate chip cookies, if you're in an attack, you can go in and it can be so overpowering that you can just start vomiting there.
Wow.
Yeah, it's wild. So excessive or repetitive noises, which obviously come up in so many different workplaces, that can definitely be, and that's our oversensitivity to noises, which is called phonophobia. Computer screen glare and just bright lights in general is called photophobia. And then rigid schedules and deadlines, that can really impact someone. It's just a lot of added stress. And, in a lot of workplaces, there's the focus on, instead of what you're actually producing and what your actual productivity is it's how late are you staying? How are you responding to emails 24/7? And that's just obviously, as most people know, that's a very toxic workplace schedule. But that's what a lot of us have become accustomed to, but that can definitely set off attacks.
Mm-hmm. Kelly, it looks like that we had Lauren that was asking, it was right around the same time as she said that about the chocolate chip cookies, but she was asking were there certain foods that can trigger migraine. So are you saying then that anything that has a smell technically then could trigger a migraine?
Oh, for sure. And then also when we're talking about the diet, food triggers are very dependent upon the person. So something that will be a dietary trigger can affect someone. And all of the migraine triggers are very personalized. But Caffeine is a big one, either too little or too much that can affect us. Alcohol. Some people have things like tyramines, or really any food could be a potential trigger for any of us.
Mm-hmm.
For a lot of people.
Yeah, and I thought I saw another question in here that was asking about computer screens. So I think that answered. Let's see. Yeah, Tristan was asking, can migraines be triggered by staring too much at gadgets or screens? So yes.
Absolutely, yes, definitely. And yeah, some people get a lot of relief with blue light glasses or screen glare protectors, or even just sunglasses, looking away from the computer. There's the 20-20-20 guideline, which is for every 20 minutes that you're staring, at your computer screen, you take 20 seconds to stare off at something that's 20 feet in front of you. So it gives your eyes like a little break. It makes sure that we remember to blink throughout it, which helps prevent dry eyes, which can trigger migraine attacks. So that can help for some people, but yeah, definitely staring at screens. I'm sure so many people here have experienced that. You're just drained.
Yeah.
Probably a good place to throw in a misconception is that, staring at screens for someone who has migraines can be a trigger, which is not the same thing as saying if you spend a lot of time looking at screens, you're going to get migraine. Like, it's not a causal factor, right? It's a risk factor, and particularly a trigger for people who have migraines. So that's another kind of thing that I think sort of common misconceptions that people get that I think complicates what we're talking about. Sorry to interrupt.
Yes, that actually made me realize I forgot the most important part of the trigger discussion is triggers are not causes of migraine. You have migraine disease and triggers can initiate an attack, but they are not the cause of migraine. You are never to blame for your migraine disease. You can engage in all the triggers like you want, you can avoid all the triggers you want, and you may still experience a migraine attack. It's not your fault, and they're not causes.
Okay. Dr. Les, you want to talk to us about countermeasures there? We've talked about a few of these. I think we've talked about off the cuff on some ideas on things to do. I liked what Kelly mentioned about the 20-20-20 rule that especially when you're looking at the screens, but do you want to talk about some of the others?
Well, I think generally speaking, if we know what our triggers are, then anything you can do to reduce those is going to be helpful. And if you catch it early enough, sometimes you can drive yourself back down underneath that. I like that analogy of, here's the line, right? And you want to keep yourself under that line. So maybe there are things that you can do. I really like the thing about looking away. But there are also longer term things that we can do. This is not immediate, but making sure, we'll talk about it just in just a little bit. I know, getting enough sleep, how you eat, doing all those things. An important piece of this is making sure that you have documented for yourself, like, what's the pattern, right? What can you learn? There are medications, there are preventative medications, and there are immediate medications. And again, that will vary from person to person. If you go out and, I refreshed in getting ready for the webinar, I refreshed myself about the different medications and what's available. And it's quite variable. The most common recommendation for most people is if you feel like you have a headache coming on, take acetaminophen or an aspirin if you can take it, right? I can't do NSAIDs, so I always do acetaminophen. But there are other medicines that are also immediate rescue medicines, and then there are preventative. So medication I don't want to go too far down this rabbit hole because it's very complicated, but it's a really good reason to have to work with someone who's an expert, who understands migraine. Typically that's a neurologist who's a headache specialist. but it can be, other people, but it's complicated. And there are things that you can do that are immediate. Obviously, prioritizing safety is just really important. I mean, we have to know, and this is a workplace issue. It's got to be okay. If I walk in and tell you I am not safe to drive, just believe me.
That's right. Yeah.
Doesn't really matter what the reason is, frankly. But if I'm in the middle of one of those twice a year migraines, I feel like a lightweight in comparison to Kelly, right? If I'm in one of those 2 migraines, I don't drive. I don't do anything safety sensitive. It's not safe. And it's really important that we believe people. So prioritizing safety means making sure that you keep yourself safe, but also that if you're in a situation where you could put other people at risk, be straight up about that.
Yeah.
That's really, really important.
Yeah, absolutely. Do you want to talk about that? Because there's questions too, and like you had mentioned about that, I feel like I'm having a stroke, that there is a difference between having a migraine and recognizing the signs of a stroke, correct? Dr. Kertay, do you want to go through maybe kind of what those specifically are?
Gosh, to be honest with you, I don't know that I know enough to be intelligent at this point. But it's a really good reason to understand if you have recurrent headaches that are coupled with photophobia, nausea, some of the kind of classic signs of migraine. It's important to get diagnosed so that all right, this is what my migraine is like. I know exactly what my migraines are like. So I can tell. And I can tell you that if I have facial droop, some of the other indicators, weakness, one-sided weakness, if I have that, I'm going to assume that it's a stroke because it's not part of my migraine picture.
Right.
So it is really important. And there's an acronym, and you probably know it, Holly, better than I do right this second. I'm not calling up the stroke, shorthand for it, but there are a series of signs that are indicators of that. You want to know what they are, right?
Yeah.
But it is a really good reason to be well diagnosed and to be working with somebody who can help you treat it, so you can tease those things apart.
Absolutely. So Kelly,
and like Kelly said, just one quick thing, Les, what your migraines feel like, and you know what is outside of the norm. But to Kelly's point, your experience can evolve too. I've had migraines since I was a teenager and kind of know what that feels like. And then post my second baby, so I've gone through 2 pregnancies, had my second baby, I started having auras and the visual distortion out of nowhere. And it was the most bizarre experience. I didn't know what it was. I didn't know what to call it. I never had the headache after. So I'd never put the 2 together that this was related to migraines. And I'm holding a newborn, having visual distortions, thinking like, what is happening the next 20 minutes? Like, am I having a stroke? What's happening? And then I actually had it in the workplace a few weeks later from that. And I remember asking our CEO, who I was in the room with at the time, are my eyes like, am my eyes dilating? What is like? What is happening to me? And he's like, no, you look fine. You look totally normal. I'm like, I've got, blinking lights and visual, just like, I can't. It's just this bizarre experience. Anyway, just to point out that symptoms can evolve over time. And once I kind of called it what it was, which was this, aura effect and this visual distortion, I was like, oh yeah, got it. But I probably, would have ended up in the emergency room saying I'm having a stroke or something's going on here. So anyway, just a side note to pay attention to how that evolves and changes.
And if it is something new, and it's potentially something else, then assume the worst, frankly.
There you go. Yep.
Right?
Err on the side of caution. Always
Err on
go
the side of caution, get it checked out, and
Yep.
then again, another good reason to work with a professional who knows what they're doing in this field so that you can sort those things out. But don't take chances and assume, right?
Yeah.
Yeah, don't sit there and just hold your newborn panicking.
Right.
Yeah.
We always
Right.
say first or worst, you should go in and get that checked out. So if there's the first symptom you've ever had, so something terrifying, when you're having, a new baby in your hand, suddenly you can't see, that's horrifying. And yeah, it's definitely better to get that checked out. And then if it's the worst ever, even if it's your normal symptoms, but it's just so much worse,
Right.
make sure you get that checked out. Definitely
That's
better
great.
safe than
Yeah.
sorry in these situations.
And then I wanted to talk a little bit more in detail about the difference between some of the preventive medications versus acute actually having a migraine attack. So I don't know, Kelly, if you want to, since I assume that you probably are pretty familiar with this since you've been dealing with it every day of your life. But if you want to talk about that, the difference there between what those interventions would be and why they're a little bit different.
Yeah, definitely. So for people who do not have regular migraine attacks, all you probably need, if you want to go the medication route, is an acute treatment. And so that's something that will help reduce the symptoms of this specific attack. And so that the baseline for, is this a really good acute treatment for me, is if you get at least a 50% reduction in symptom severity within 2 hours. And if you're not getting that, then yeah, we can try so many different classes. There's so many options out there. Even if you try 2 different drugs in the same medication class, they can work so differently for each person. So it's a very difficult trial and error process, but it's worth it if you actually find something that works for you. And then for preventive, usually the basic guideline is if you're having 4 or more migraine attacks per month, you probably want to be on a preventive medication. And obviously that has caveats. So if you're someone who, only gets 2 a month, but the length of your attacks, are a week long, that's half your month experiencing migraine. Like you should probably be on a preventive medication. And so the preventive medication obviously prevents the frequency and severity of attacks. So it's not just how rare you get them, it's like how intense the symptoms are. And this can be anything from, like oral drugs to Botox, to nerve blocks, infusions, etc. Also with acute medications, if you take them at the first sign of an attack, that will prevent your migraine attack from going to different areas of the brain and affecting your full body. The longer you wait to take it, the less effective it is. So if you are able to, try to make sure that you take it early. And also make sure for most of the acute drugs, make sure you're not taking them too frequently, usually more than twice a week, because it can actually go into medication overuse headache, which is different than migraine, but it makes the migraine attacks worse and horrible. And it's just completely unfair that we're trying to, stop our migraine and we get another headache disorder on top of that.
Yeah.
It's sort of difficult to treat, but once you stop that medication, even if you need extra help for that, that will go away, luckily. And the best part of that is that recent acute drugs called the Gepants and Ditans, they don't have that risk, which is fantastic. And when you take them, they can actually also work as a preventive.
Wow.
So thank gosh, we definitely deserve that, because there's nothing cooler than trying to stop an attack and making another one come up. Because
Kelly,
is that too fast?
no, that's perfect, and it's like I'm watching our chat from what we see here, but then also seeing what our internal chat is, and it's like everybody's like, I have these same symptoms, I think this is me. maybe this would help, this would work for me. That's fantastic. And the other thing I wanted you to touch on was, I'm sure there's people that are hearing for the first time that, hey, all these symptoms, I may be having migraines. Talk to me about the emergency kits that maybe you could have with you, and where you would store that, and how that could help.
Yes, so we typically call this our migraine toolkit, and it can be completely dependent on what tools you use. So mine, I always have, like a big backpack or a huge purse on me at all times, especially, if I am going somewhere where I can't get back to my house, like if I'm going on a car ride, if I'm going like out somewhere, and it's completely dependent on what works for you. So for me, for example, I have a lot of earplugs, I have dark sunglasses, I have all the different types of medication, whether it's my nausea medication, whether it's my head pain medication. I have those. I have little, they're called neuromodulation devices. And so they're another recent development. So if you can't have drugs, or you don't want drugs, you can use electricity and different methods like that are approved and have great research behind them. I have those. I have vomit bags, which is very glamorous to be carrying around at all times. So it's heating pads, ice packs, whatever you need to make yourself comfortable. And even just having that on hand and knowing that if this happens, you will be safe and you will be able to take care of yourself can relieve so much stress. Yeah, any questions about that, or?
No, I think that's exactly what I was asking about. Talk to us then about the workplace accommodations. How can we change this? And then we'll get to questions.
Yes. So what's great about so many of these workplace accommodations is they are incredibly inexpensive. A lot of them don't really require any expense from your employer. And a lot of them will actually help all employees, because what is good for migraine health typically is good for brain health. And what is good for brain health is typically good for overall health. So all employees can benefit from this. So yeah, let's start. Limit noise levels and provide adjustable lighting. Even if an employee can't be repositioned, outside of, like the lunchroom where there's like odors and noises and lights, or away from a window or close to a window, depending on whether they prefer natural light or if that's rough for them. Just make sure that you create an environment where it's not stigmatized to wear earphones, wear noise canceling equipment, wear sunglasses if you need it, wear caps. Make sure that people won't be embarrassed to do so. And then, of course, we talked about the anti-glare filters on computers, and the tinted eyeglasses. A lot of people prefer the blue light blocking glasses, and that can help their eye strain, which can help prevent migraine attacks. The fragrance-free environment. I know me and the people in the chat saying how brutal smells can be. Definitely appreciate that. So that's asking your employees not to wear perfume, cologne, scented lotions, and then considering what in the office can also be a very triggering scent. So cleaning products can be rough. The soaps that are in the bathrooms, if there's, expo markers or something, see if there's other options, or make sure that the employee is able to be positioned somewhere away, maybe closer to an air purifier. Just make sure that they are comfortable and, again, are not embarrassed to ask for these accommodations. And then the dark, quiet space for employees would be huge for so many people of so many different health conditions. Just to relax, not have to explain, not have to be embarrassed, but then be able to go in there, have dark, have silence, be able to relax, be able to use different treatments, that even like a heating pad or something that they won't have to explain to other people. And like we talked about before, even if that means that they can just go, sit in their car without being asked, or without being, hounded and saying like, oh, when are you coming back? Will you report? This privacy can do a ton for the level of stress someone is feeling during an attack. And then flexible and remote scheduling is a godsend for people with so many different chronic pain and chronic health conditions, because it's very unpredictable when it's going to attack you and when this is going to happen. So even if I can't do an assignment today because I'm feeling horrible, I can make it up, or I can do preventative hours. And again, focusing on the the end products versus were you in the office for 19 hours a day, so just focus on what is truly important versus putting up the facade of productivity. Or also, if you're a coworker and you see someone else who has been able to confide in you and trust you enough to be like, hey, I am experiencing a migraine attack, can you cover this assignment for me? I will definitely have your back the next time you need it or even just want it. So just work together and just do what you would want in that situation.
That's such a good point, Kelly, about bringing that up and sharing with other people about what you're going through, because you can't see it. So how is anybody going to know unless you feel vulnerable and confident enough to be able to share that with them?
And Dr. Kertay and Kelly, I think we kind of hinted at it here, but migraines are considered a disability covered by the ADA, correct?
Yep.
So I think that's something that people don't think about this very often, that this is something that as employers we should be accommodating. If somebody comes to us and complains, we need to make sure that they do have support within the workplace. It's not just a do the right thing kind of thing. It's a legally you've got to do the right thing here.
Right. Yes. I think it's always good to have the caveat with, when it comes to the ADA, it can be considered a disability. It isn't automatically a disability under the ADA, but it can be. And so it's really important to treat it in the same way that you would treat anything that an employee tells you. And you're absolutely right. If you are subject to the ADA and it is considered a disability, you don't have a choice.
Yeah.
Right. It's
right.
I mean, there's all the stuff about if it's too much of a hardship, all of that, but generally speaking, you have to at least engage in the process.
Yeah.
Exactly. I guess my point is, of course, you should always engage in that process, but don't just kind of discount the conversation because you just don't really know or think about it. And so I think that it's one of those that if you're not thinking about it, if you're a supervisor and you're not aware, HR, should have that process and you should be able to engage in that typical process for accommodations. But if you're a supervisor who an employee comes to with this information, you need to make sure that you've done the right thing and done the right thing.
Right.
And we have a ton of.
Go ahead.
Sorry. We have a ton of resources on our website. For example, like an article that's specifically titled "Is Migraine a Disability?" and it goes into all of the caveats and it tells what employees are able to do and what employers are able to do and how to best help each person. I would encourage anyone to check that out if they need details.
Colton had mentioned intermittent FMLA.
Yep.
Yeah. Dara, talk to us about the Seeds for Success, and then let's hop into some of these questions before we wrap it up.
Les, were you about to say something too?
No, it's not. It's not important enough.
Oh, everything's important when it comes from you. Say it. Say it. Say it.
Well, all right. I'll be really quick. The thing about flexible scheduling, some jobs can't be done flexibly, but there is at this point overwhelming evidence that when work can be flexible, it's way cheaper for employers to have flexible scheduling and let people get the work done when they can get it done than it is to enforce a rigid schedule. It's just, it's cheaper. You're not going to spend more money doing that. We have plenty of evidence for that. So that's all.
Yeah,
I totally agree. I think it's worth saying again, and I think thank you for saying that. And I do think, I go back to the original part of the conversation, which was, the similarities between the stigma around mental health and migraines. It really is something that people want to work. So we need to believe them that they want to work. So what we could do to help them be productive and get their job done, we should. So Seeds for Success, sleep, exercise, eating, drinking, stress, these were some of the those triggers but triggers and preventative components that Kelly talked about. So it's knowing how these things affect us and affect our bodies. This is probably better for all of us, not just those that are affected by migraines, but understanding how these different components affect our day-to-day health and life is probably something we should all be doing, but especially for those that are dealing with migraine disorder and are very sensitive to these areas.
Absolutely.
And something Les talked on earlier that I meant to follow up on. He was saying about tracking your symptoms and your medications, etc., can really help identify these triggers. So yeah, we call it using a migraine diary, and there's tons of free apps that make it really easy to do so.
Yeah, the Mayo Clinic site, when it talks about migraines, their D is diary.
Diary, yeah.
Right. So which is just specific. That's specific to migraine, but it's a really good thing to remember, that like keeping that diary so that you know what your triggers are and you know what makes it better is really really helpful.
Yeah.
And again, I would argue that all of us should probably be doing that, not just those with migraines.
And I gave Dara that slide because she does a really good job lately of getting her act together, like with her diet and her sleep and all of her things. Like me, I'm probably more on the hot mess side, but Dara has got her act together these days in those areas. So we let her.
But I do document it, and I can look back and see and tweak if I'm not doing well. So anyway, that's a side lecture.
There are some resources here. Again, we talked about that, we put them in the resource section, but I just wanted to kind of give you an example. But so many good checklists and what to say and what you can do in the workplace. Kelly, the website that you guys have is just a wealth of information, all kinds of resources and tools that were great for this.
And again, if you need anything else, please feel free to reach out to me. I would love to help anyone who is struggling, or anyone who's like doing the work to make it easier for other people.
Yeah. We had some questions. We can do these kind of quickly. Let's see. Hunter was asking. Let's see. Colton was asking, does acupuncture help, or is this some type of a pseudoscience? Kelly, you want to take that? Yeah.
Yeah, there are tons of good studies showing that works for a lot of people, specifically with migraine. Obviously, every treatment will work differently for different people, but yes.
Yeah. Mary was saying that this was great, and she had not thought about the migraine kit. So I'm so glad that we could talk about some of those things, Mary. Yeah, that's awesome. Josh was saying that Botox hurts. Colton was asking about Botox for IV treatments. I think we've covered both of those there. Dan stepped in with Mr. Information himself and said, what you're looking for, Dr. Les, was fast. The facial drooping, the arm weakness.
Yeah, there you go. Thanks.
Time to call the ambulance, etc. Yeah. A lot of people sharing their own experiences here about how frequently they have migraines. We did have one that asked about attendance policies. This is a good one. And so the question was, 2 incidents a year, it wouldn't violate an attendance policy. But what about people that max out their time? That would put them over the threshold for termination. I would assume that would be covered under protected. Somebody want to comment on that? Dara, Kelly, or Les?
Just if you know that it's if you've gone through the process and it is a disability, that can be an accommodation, right?
Yeah.
And you have to deal with it as if it's going to be an accommodation, again, assuming you're subject to ADA, et cetera, et cetera, et cetera. So a policy can't be rigidly enforced in that setting if there's someone. On the other hand, if your employer doesn't know, if you haven't said it, if you haven't talked about it, if you haven't gone through that process, you're not protected.
Good point.
And so that's another reason that it's important to, to know what's going on for you and to bring it up.
Or like you've both said, if you can manage flexible work schedules, get creative.
Yep.
Good point. Barbara was asking, is it common to get migraines in the morning around 4 a.m.?
Yes, very much so. So actually, 50% of migraine attacks occur from 4 to 8 a.m. And it can be brutal. And there's a bunch of different factors on why that is. One could be caffeine. One could be that our like natural pain relievers are very low at that point. One potential factor could be the migraine, the medication overuse headache. So make sure it's not that. Poor sleep is a trigger. There's so many factors. And if you want to email me, I can send you some resources on how best to address that and try to figure out what could be the potential causes. So kelly@migraineatwork.org.
Fantastic. Guys, thank you so much. You've all been so helpful, and this has been such a great topic. I can't believe the number of questions that we've had over this, but it's something that obviously resonates with so many. And I appreciate the opportunity to share it and also to hear from you guys. I've been enlightened. I know that I've learned more today, and I hope that you guys have as well. If you haven't already, please hit that register now button. We're going to be talking all things sprains and strains this next month, and you don't want to miss that. So thank you again, and we will see you then in, I guess that would be August. See you in August.
Thanks, guys.
Thank
Bye-bye.
you.